So I'd like to welcome all our viewers this morning to the Conscious Visionary Nurses on the Edge of Evolution. I'm waiting for my next speaker to come on board, and I'm very excited that we are having a wonderful telesummit. This has been a remarkable experience for me because I absolutely love talking to all these visionary human beings that see the possibilities of the future from so many different perspectives. So it's with great pleasure that you are sharing this telesummit, and I invite you to share it with your friends. You know, my dream is to reach as many nurses as possible so we can change the future. Hi.
Hey, Mary, how are you?
Great. Is it the art behind you?
It is, yes.
Oh, that is fantastic. So you're a scientist and an artist.
As are you.
I know it. I know it. And you're also involved with research in Indiana at the University School of Nursing in Indiana.
Yeah, Indiana University. Yeah, I'm the Associate Dean for Research there.
That is great.
And
Well,
we have many campuses, but some of the schools are accredited independently, but
right.
3 of us are accredited together. So down in Bloomington, Fort Wayne, and Indianapolis, we all function as one school.
That's great. And you're also an inventor. You invented a scale?
I did, yes.
Oh, that's so cool.
That was fun.
That is fantastic. Well, I'm excited. You know, you're one of the creatives, you know, nursing and being a creative. And I'm so excited to be interviewing you because this has been an incredible experience for me, you know, getting to talk to people all over the country, all over the world on what the future lies ahead of us. And there's been, you know, with nursing in the forefront and really out there meeting the needs at this point in time, has been incredible, an incredible inspiration. And I'm interviewing people so we as nurses can hear some of the most powerful voices and visionary voices of the future. And I'm very excited to be interviewing you. So what I'm interested in you sharing, you know, is how do you see us taking this moment in time? You know, it's the decade, we're celebrating 2020 is the decade of the midwife and the nurse. And what inspired me to do this was, you know, Nightingale was a visionary, and now what she said 200 years ago is still relevant today. So I am really thinking that we can create a collective of voices of nurse visionaries of what the future can be. So I'm excited to hear what your ideas are and what some of your creative projections of what we can work towards in the future.
Well, I'm so excited to be here talking with you. I think this is such a great idea that you're doing this. And I think sitting in your seat, how much fun it must be for you to be able to talk with everybody and hear all these things everyone's saying. It's just wonderful.
It is.
It's really great. I think you're right in that this is a really critical time. I think we really see what our nurses are going through right now. Being on the front line, they are directly in harm's way. They're risking their lives for other people. And in a way, it's unconscionable what's happening. And I really applaud the people that are working so hard right now. I think it's changing our image of nursing. And the images in the media, on social media that you see are very different than I think how we've thought of nursing in the past.
Right.
But I think it's also sort of falsely emphasizing the acute bedside care that nurses do. And I think back to Florence Nightingale and her work with the Crimean soldiers and our images of a nurse tending someone at the bedside, the cot side, in the trenches, right?
Right.
But we've kind of translated that, I think we've translated that image into nursing at the bedside in an acute care setting. And we've forgotten the fact that Florence Nightingale was all about health promotion. She was trying to get those soldiers back to health and their utmost health and well-being. And so as nurses, I think we've kind of lost that side of ourselves. We've lost the side that has to do with preventing hospitalizations in the first place, preventing these chronic illnesses. And in a way, if we had been working in that space for the last 20 or 25 years, I think the impact of this pandemic would certainly be less. And the health disparities that we see right now that are causing such an issue with the pandemic maybe wouldn't be such an issue as well. So I think my image is kind of re-envisioning the visual images of nursing, as well as taking some concrete steps to move nursing into a different space.
Right. So what do you think some of those concrete steps could be for us to take?
Yeah, I think a lot, I'm such a visual person being an artist. And so I always think about, what is our collective image of nursing? And so part of me wants to change that collective image and wants to show, there was a video that was done and it showed nurse midwives, helping at the births of babies and teaching mothers to breastfeed and those kind of wonderful things. But we also don't really have an image of nurses in people's homes, looking in the refrigerator, looking in the cupboard, what are you eating? What salt-free foods do you have available to you? What's your neighborhood look like in terms of safe exercise and access to grocery stores and that kind of thing? So I'd like to kind of change that imagery of nursing, but I also think we need to realign a lot of our national organizations. And the first thing I think of is our state boards of nursing, because our state boards are based on an acute care healthcare model. Sure. And so we really have to change the format and the function of the state board questions. Yes. If we really want to do this and have more of an impact in the public space. And I think a lot about our research funding. As the Associate Dean for Research, there's been a flurry of funding opportunities related to COVID-19. And they're very responsive in terms of what's needed now in the acute care setting, which is necessary and important. But in the long run, I don't think they're necessarily positioning ourselves for that post-COVID world and where we need to be post-COVID. And I think that's understandable because I think right now we are in that crisis mode. But ultimately, we need to get to that vision of that post-COVID world, and we need to think about what are our priorities. Health promotion is a priority of like National Institute of Nursing Research, but it's not the major emphasis, right? I think in some ways we have tracked onto what our physician and other basic science colleagues are doing, which are very specialized care, very specialized funding, genomics, omics. Again, very important, but not the full story. We have to think about the full picture, health promotion as well as chronic disease management and treatment, right? But it's like we're so focused on that chronic disease and multi-comorbidities that we've sort of forgotten that the importance of preventing them in the first place.
So research sort of flows where the grant applications are coming from. So how would we as a nursing, turn around where do we need to go and speak to talk about that health promotion, prevention is what we need to be proactive in focusing on? Who would we talk to? Would it be our legislators? Who's making those decisions? That's where the research funding is coming from.
Well, I think the good news there is that a lot of the funding that's coming from nursing organizations, we have colleagues that sit on those panels that set national research agendas. And so I think it's up to our colleagues to take this information and say, yes, I agree that symptom management in cancer patients is really important, but what about cancer prevention? And can we put equal amounts of funding to both of these areas? The National Institute of Nursing Research has a council that meets. Can we write to our institute director? Can we write to program officers? Can we have these conversations at our regional and national meetings where we often have representation from program officers and other folks? Can we begin to really look at how those dollars are allocated and begin to have more of a even, maybe not an even distribution, but a more well-rounded, I would say, distribution of that funding. Yeah.
Yeah. I think that's critical because I think I was a qualitative researcher that was studying, integrating arts as a way of healing. And, I did it as my dissertation, but when you wanted to really implement change in the system, it needed to be validated and it needed to have funding, which, at that point in time, it was scarce, it wasn't there. So until there's research, we don't really step into the evidence-based practice, which has become, the mantra. So that to me has created a lot of barriers for us to move forward.
And I think our evidence-based practice is also a little bit out of kilter because our evidence-based practice is almost entirely focused on the hospital setting.
Right.
But when we go to evidence-based practice councils at our healthcare providers, there's the outpatient side, and they're sort of saying, well, what about protocols for us? And, what is evidence-based for us? And
Right.
they're really sort of floundering. And I think that's a space where nurses are not as present and really need to be much more present in that setting. And so if there's a way we can begin to frame evidence-based practice as well, I think that's really important. And then our schools research can align better with our healthcare providers as well, which just makes those partnerships stronger, makes the healthcare system better, makes the schools better. I just think that's really important. Yeah.
So let me ask you, where do you see, like for the listeners and where they're at? Hopefully I'm reaching out to nurses from many, many different backgrounds. Can you tell me what are some of the things that they can do starting right now, specifically to create the future? How can we empower ourselves to be more creative, stand up and have our voices heard? How we can sort of activate the potential of where our discipline is, where our profession is going based on the values of nursing?
That's a wonderful question. I think nurses are really great at saying, this doesn't make any sense at all to me. Right. And they question what they're doing. They create workarounds. They're really good at seeing situations that just don't make any sense. And I think really listening to that inner voice and figuring out, okay, what would make sense, right? Maybe this whole space is wrong and we need to be in a completely different space, right? And so listening to the nurses, on social media, lots of nurses are posting about, please stay home. You're not just influencing, it's not just yourself, it's all the other people you may be infecting. Okay, so how do we get to that space? How do we really have messages then that are going to the public? We're not there. We're dealing with PPE shortages. We're addressing critical hospital bedside nursing needs.
Right.
And again, it's very necessary, but it's to the exclusion of this other space. So how can we get ourselves in both spaces? And I think nurses can be really creative and think that through. And so whatever level that people are practicing at, whether it's bedside nursing, it's an administrative role, you might be an evidence-based practice nurse, or you might be a researcher. How can we think about this other side of the coin and really get ourselves to be in both worlds and balanced more on both sides of that? I think that's critical. And so I see it as every single one of us needs to think through that. I think we all can come up with ideas and solutions. I think nurses as a whole are really creative, thoughtful people. And so I don't think this is as difficult as maybe people think it might be. And there are so many of us around the country that we could really make a huge difference in the healthcare of American people as well as people all over the world, right? We also, in schools of nursing, we also have wonderful partnerships, international partnerships. And so that gives us the ability not just to think about our own local system or our American healthcare system, but also to look at internationally. What are our colleagues doing? What have they done well? We see our colleagues in Taiwan that have been such a leader in preventing the spread of this within their country. And how can we take some of those ideas and bring those to the US?
Exactly.
So, yeah.
And one of the things I'm trying to explore with, the internet and social media and how to outreach, because publications are so slow, and there's so
Yeah.
much labor in getting the word out there. But it seems to me, like NPR and some of these radios and TVs and social networks, what I was thinking when I was doing this telesummit is our media needs to be talking to the nurses right now.
Yes, absolutely. Yes.
So that was
But I
something.
think the media needs to be talking to the nurses, not just about the bedside ICU acute care setting, but how could we have prevented this, or what else do you see? How do you view the health needs of the American public, right? So that we get this bigger picture. That would be fantastic if we could do that.
Yeah, and also the public health issues that are arising right now, since the people who are, if you're not really, really sick, you need to stay home.
Yes.
How do we provide support to all the people who are at home, and how are we meeting their healthcare needs during this time?
Yes, because I think we're not really meeting their healthcare needs, right?
Yeah.
There's some limited telehealth visits, but if you really have an issue, you're probably not going to be going into the clinic, right? You're going to want to avoid going to the clinic for a while, I think. I think the other thing that's difficult about this situation is that we simultaneously have to do so many things, right? We have to be in this acute, do I have food this week? Is my family safe? Are we taking all the steps to be well? We also have to think about the next week, the next year, and this whole entire post-COVID world. So we have to live in all these different layers of time all at the same time as well. And I think that also gets to your question about what can people do now, is kind of recognize how able are they to kind of be present in the now, but also to think about the future and what we need. And maybe it's next week in the future, and maybe it's next month, maybe it's 2 or 3 years from now that people are able to do, but whatever people can do, I think is really important.
That's really beautiful. And what I was going to ask you, if you could see, like, just for you, for example, based on your experience, what you know to be true, being an artist, how can, like, I'd love for us to think out of the box. If we could step out of what we know, even in this moment, just like I feel like we're looking for a quantum leap into the future. I don't know. And that means you're sort of jumping into the abyss of what the unknown is. So I know we don't know the future, but if we could have a glimpse of it, where do you think some of those, do you have any glimpses of that?
Of what it will look like?
Yeah.
That future?
Yeah.
I think one of the things that has really struck me is how important the collective is becoming, which is a major shift for us as Americans. It's not as big of a shift for some of our colleagues in other countries, but that collective thinking is going to be much more important. The thinking about the benefits to the many. I think we have to move beyond our focus on ourselves and some of our independence and freedoms that we've had to think about what's good for society as a whole. We haven't done that much as Americans. And so I think that's going to be a huge shift. But I think we're going to see that naturally emerge, because if this situation continues as long as people are sort of envisioning it may continue, we're going to be relying on each other a lot more.
Right.
And so I think some of that sense of community and collectiveness may emerge naturally as part of this.
That's beautiful. So what I hear you saying is, the collective, how we can merge as a collective, changing our mindset from what's good for ourselves and just our own focus in life, which has been based on, our independence and freedom. How do we emerge to create a collective mindset as we move into the future in taking care of ourselves as communities?
Yeah. And I think, art is really interesting as a vehicle. So I've been doing some work with disseminating scientific facts through art.
You have?
And what I've learned, it's so much fun. I did an exhibit it's concept art for an
Yeah.
exhibit that people, eventually I'm hoping people can walk through. It may need to be virtual now with all of us being stuck at home,
Uh-huh.
but it teaches people facts about menopausal hot flashes. We don't have classes, we have classes for when people begin their periods, but we don't have classes for when people stop
Right.
having their periods. And so people are sort of left hanging with, what does this mean, and what am I feeling, and how do I make sense of this? And their partners are confused. Even healthcare professionals report being confused about it. But what I've learned about doing that project is art is really unique in that it can create a collective image, and
Yeah.
it can also motivate social action in a way that other written work or voiceovers or more traditional forms of media can't do. And
Exactly.
so maybe there's really a huge role for art here, in displaying things, communicating things to people. That might be an important vehicle to change how we're doing things.
That is really amazing. What I just came up for me was having, using art to reflect a phenomenon that's happening in human beings, for example, hot flashes, and how we can learn from that experience aesthetically, knowing and being able to relate to understanding ourselves better and each other.
Yes. And also, I think shifting some of the rhetoric that's present.
Mhm.
So, and around menopausal hot flashes, the rhetoric is fairly negative. And
Right.
so one of the things we've done is we've illustrated where people in different cultures feel hot flashes on their body with flowers,
Oh,
because flowers evoke blossoming, blooming naturalness,
yeah.
right? And so it's a completely different feeling that's generated by that art. It gives people a different image
Yeah.
than sort of this, oh, the woman suffering with the hot
Oh,
flashes. And so the art, I think, is so important because it can convey what that collective image could look like, right? Like, what does it mean to come together as a society? What does it mean to come together around healthcare needs? What does it mean to really support people's healthcare needs, both promotion and acute and chronic illness prevention and treatment, right? And I think sometimes people have a hard time understanding things. And
yeah.
so if you give them the image, then they have something to work from and take off from. And picture is worth 1,000 words, right?
Of course.
And it's so much, to me, it's so much better to show something via art
I've
and
got this
image.
great idea. I think it would be so cool to go to a local museum and work with a curator and have them do a call to artists to make art about the experience of hot flashes, and have artists submit their renderings of this, and then women would go, and it would be just, it could travel,
Yes,
just that one, and that would be a great kind of research, that the paintings themselves is the expression, the manifestation of the research project.
yes, yeah,
I
yeah.
love that. I love the idea when you have a hot flash that your whole body is blossoming,
Blossoming.
flowering. It's this
Yes,
blossoming of this energy, of this beautiful transformation that you're experiencing. And it's like restoring this phenomenon,
yes, it is. Yeah, it is. Restoring. That's a great phrase to use for this.
yeah,
Yes.
restoring. I love that. So tell me more about the way you've used art in healthcare.
That project is my first foray into using
Good.
art. And we had some funding and did focus groups, and then we did viewing events. The focus groups helped us refine the art
Yeah.
so that it really was conveying what we wanted to convey. It's
Right.
interesting how people can misinterpret what you intend to show. So I
Yeah.
think that kind of community engagement is really important to get
Okay.
feedback. And then we had viewing events, public viewing events, and we've had people look at it, look at this concept art. And the concept art shows the artwork, but also shows it in like a 3D rendering so that you can picture what it would be like to stand in front of something.
Wow.
And so it's like you're standing in front of the exhibit when you look at the artwork. And so people have the concept of what the exhibit would look like if it's full scale.
Right.
as well as, these visions. And then the one that I was talking about with the flowers, we actually made that as a full-size sculptural exhibit. So
You did.
I purchased dress form mannequins and created these sculptures out of these dress form mannequins. And people really, I think one of the things that conveyed to people, it's all about individual variation and how we experience things. And people really resonated with that in particular because it captured differences among racial and ethnic groups, but
Right.
it also made it okay that people didn't, I remember one woman said, "Oh, I feel them in my ears." And it was like, it was okay for her because there was these three different ways. Why couldn't there be a fourth way or a fifth
Of
way?
course.
So it also opens up the possibilities for people, which is really great. And your idea of transformation, one of our pieces is silica beads on the floor, kind of in a mandala type setting, and then a sculpture of a woman rising from it. And the idea is that, fire transforms steel and glass, silica
Yeah.
into glass, and why can't this fire at menopause transform women as well? And so it's a very different way, again, of thinking about menopause and the transition, from, what our rhetoric is, it's a loss of femininity and it's a loss of, you're losing your youth, right? It's
Right.
very, very negative. And so this idea of you're transforming yourself into something even more beautiful is just a really positive image to have for people.
Wow. What came up for me is like having a what is it, Pinterest or something, where people put images on and
Yes.
have all this menopausal, pieces of art that people post about it, and or images that relate to that, and creating a collective imagery, like an inventory of images. I never thought about that, but that's like to me, that's the kind of things that we can do in the future, like how to use images in just different, more creative ways. Like
Yeah.
one of the things I talk about, you know, in my course is how do we get nurses to implement the arts at the bedside? How do we integrate music and dancing and all these different things? And what I found is when nurses bring the arts into their practice and whatever, they are so powerfully effective because they understand holistically the person they're dealing with, and they also have the skills to embrace the phenomenon in a very beautiful way. So I think the future of nursing, as we expand ourselves, integrating all these different aspects of what's possible. Art to me is
Absolutely.
so phenomenal. And I'm so excited about this idea that you have of bringing art as part of the research and as defining the phenomenon of hot flashes. To me, these are the kind of innovative ways that we can step forward into the future. And truth, who knows where they'll take us?
Right, right. And I think we see things in the media, we see images in the media, we see these exponential curves, we
Right.
see social networking analyses, right? But for people who have never seen that before, it can be really hard to interpret. And so putting those into more of an artistic rendering can convey a lot of different information. There was an artist who created a flowers exhibit, and the color of the petals had to do with how much bruising was experienced. The dots on the flowers had to do with petechiae. And so it was related like to her own or a family member's illness,
Right.
but it conveyed like that typical diary data that we would get in this much different fashion. And you could see, you get a picture of the whole as well as parts of things. And I think that's another reason that art is so powerful, is you kind of get the gestalt and then can hone in on individual pieces or parts of it.
Of
So
course. Yeah,
yeah.
art is so powerful because when I first started the program, just having patients who didn't have that much artistic experience, they could communicate their pain in ways that were,
Yes.
you could really suddenly comprehend the depth of their experience through their drawing versus their words.
Yes. Yes.
And to me, integrating that into the way we communicate with each other and the way we relate to each other is just phenomenally powerful.
It could be powerful. And even if it's, even if it was an exhibit about, I could envision something that I could do related to what I think nursing should look like, right? How we should be interacting with people, and, do something around that, some kind of artwork around that would be, I think, really powerful, really powerful.
I love that.
Maybe I'll have to work on that, right?
I think you should work on that. I love that. And then we'll do a whatever the future is, then we'll do this whole exhibit. And I think it's important for us to have our research findings go to the public.
Yes.
To me, research goes to the other professionals, but somehow I think in the future, our research, our projects should go directly from, like journalists go right to the public. Nurses need to go right to the public with their findings. We don't have to go through, I know that the peer review and all this stuff, it's logistics that just slow us down and burden us down. I just think we should jump to the public and say, this is what we know to be true, and we're here to help you, and trust each other.
Yes.
Trust each other, that everyone's voice as a nurse, based on their experience, that we can trust each other.
Yes. And it's funny that you say that, because the exhibit that I created, I estimate there's 500 research articles probably represented in that exhibit. And so, that's an amazing amount to think about in something you can walk through. The concept art you can see in 15 minutes. The exhibit to walk through would probably be a 30-minute experience, right? But to be able to absorb all of that in that short amount of time is really powerful for people.
Really powerful.
Yeah.
Well, send me all the links so I can see your work.
I will. All of that is at
the Telesummit, like in the information of the Telesummit. Show the links to your course, everything, when you do that. So when people listen to your lecture, in our interview, they can come back and check all those things out and let that inspire, not only, inspire nursing in the future, because you are a visionary. You are already in the future. I love it. It's amazing. You're not talking about the future. You are in the future. Thank you so much. Is there anything else you want to say in conclusion?
It has been my pleasure to be here. I'm just so happy that you asked me to be part of this. I really feel honored about it. So thank you so much.
Thank you. I am so appreciative. I don't know how we found each other, but I just am so excited. I'm so excited to be interviewing you, and I just love spending this time with you. And thank you. And let's stay in touch.
Yes, we will. Well, we'll be in touch. Let me know about the interviews.
Okay.
And how we can transcribe those and maybe get those to Marion for Nursing Out.
I will definitely do that.
Okay.
Okay. Awesome. Thank you so much.
My pleasure.
Bye. Bye. Bye.